Good morning, students. Today we will be doing the kinematics of elbow joint, and we will start with the axis of motion of flexion, elbow flexion and extension. In the last lecture, we covered the articular surfaces of the elbow joint. We covered the joint capsule, the role of joint capsule, how it is loose and there are synovial folds in it. The fat pads are there which can cause trouble like elbow. There can be a tennis elbow or lateral epicondylitis can be there. We also study about the ligaments, the role of medial collateral ligaments, the triangular ligament as well as the lateral collateral ligament complex. Fine. Now today we will be continuing the same topic as the kinematics of elbow joint. Now the axis of motion of elbow joint is now when we take it in the anatomical position, when we take the upper limb in the anatomical position, the axis is the intersection of the point from the longitudinal axis of the humerus, and the condyles. Can you see the condyles, or if I can say the trochlea and the capitulum? If this is the bone, it is a longitudinal axis passing through the humerus bone, and the line which is passing through the capitulum and the trochlea, this line. Now when this intersects, this becomes the axis of motion. This becomes the axis, but this axis is not a perpendicular axis. If you can see, the longitudinal axis of humerus as well as the line which is passing to the capitulum and the trochlea is not a straight line. There is a deviation of valgus or degree, 4 to 8 degree of deviation. You can see this in this image also. There is a little bit of deviation which gives us the scope of rotation or spinning. Fine. We have already seen that whenever the elbow flexion takes place, there is a kind of a adduction variant which is taking place. That is, with elbow flexion, there is a rotational movement which also happen with flexion. There is an adduction movement which is taking place, and with elbow extension, there is an abduction movement which is taking place, or a rotational or a spinning movement which is taking place. This is because of the axis which is there. Now, what are the factors we keep in mind when in mobility and stability of the elbow joint? Now, we understand that elbow joint is very crucial, and there is a role of the position of the active range. That is, you understand the active range is always less as compared to the passive range. The active range is restricted by the contracting muscles of the forearms, arm. So that is why the active range is always less than the passive range. The other factor to be taken into point is the two joint muscles, that is the shoulder complex. We have got two muscles, biceps and triceps. So the position of the shoulder also plays a very crucial role in the mobility and stability of the elbow joint. The third important factor which should be kept in mind is the rotational movement of the forearm. Now you understand, when the forearm is supinated, the range of motion is more as compared to when the arm is in pronated position. Fine. So these are the three factors, that is the role of shoulder because of the two joint muscle, the role of forearm for the pronation and the supination, and the role of active and passive range of motion. These three are the main factors which should be kept in mind, which influence the range of mobility influence the mobility and the stability at the elbow joint. Now let us see what factors influence when the elbow flexion takes place. Now when the elbow flexion takes place, one have to keep in mind that the coracoid fossa is going into the coracoid, or the coracoid process is going into the coracoid fossa. You have to keep that in mind. Or the head, basically if it is going, then it is easy. That is, it is easy for the movement to take place. Or we need to see any two joint muscles. That means the passive strain of triceps muscle, it can restrict the factors which can restrict the motion. So you need to keep in mind, that is the first is the coronoid process should go into coronoid fossa, and then the second is the passive tension of triceps muscles, or the passive tension of posterior capsule of the elbow joint should be kept in mind. The role of medial collateral ligaments should be also kept in mind, because they get taut in when the movement is taking place, because they are responsible for resisting the joint distraction forces, as we discussed in the last lecture, as well as they are responsible for restricting any kind of valgus, resisting any kind of a valgus stress which comes. Fine. An interior joint capsule is very much important because it provides the stability at the for varus and valgus stress when the motion is taking place. So the role of anterior joint capsule, the posterior capsule stretching, the tension at the posterior two joint muscle, that is triceps, again the role of medial collateral ligament, and of course the role of all the bony structures. That means the coronoid process should go to the coronoid fossa, as well as the head of the radius should go into the radial fossa. These structures, these features should be always kept in mind when elbow flexion is taking place. So these factors should be always kept in mind. When there is an elbow pain, the elbow is kept at around about 80 degrees of flexion, so that the capsule is not taut. The anterior posterior capsule is responsible for maintenance of or resisting the valgus and the varus forces around the elbow. So elbow flexion should be 80 degrees so that the capsule is not stretched. At 80 degrees, the anterior and the posterior part of the capsule is in neutral position. So every time we need to keep it at 80 degrees of elbow flexion, so that the pain is less and the capsule is less taut, and the any kind of a swelling, any kind of a injury will be healed more over there. Fine. Now, what are the factors which affect again the motion at the extension? You should keep in mind is again the passive tension of biceps muscle. Now here you can also see whether the olecranon process is going into olecranon fossa or not. You have to see over here the lateral collateral ligament, which provides the resistance to the all the varus kind of forces. The role of anterior joint capsule, because it is giving passive tension to the during the extension motion. So these are the factors, or these are the points you need to keep in mind while we are seeing the elbow extension or the elbow extension is happening. So there are some factors to be kept in mind in elbow flexion as well as in elbow extension. So the next point which is very much important over here is the carrying angle. Now the carrying angle is when we put our upper limb in anatomical position. That is, in anatomical position is when the elbows goes into extension. I have tried to put it in the anatomical position, and if you can see, let me show while I am standing. You can see this. My elbow has gone to, or my shoulder has gone into extension. Elbow is in extension, and the forearm is in supination position. The forearm is in supination position, and you can see the angle is wide apart. It is very, you can see it is giving way, and you can see that it is away from my trunk and it's away from my lower limb. Fine. Now, when the angle is, or the longitudinal axis of the humerus and the longitudinal axis of the forearm, fine, they are not in a straight line. You can see that. I am showing you again the longitudinal axis of the humerus as well as the longitudinal axis of the forearm. They are not in a straight line. Why? If longitudinal axis of the humerus is running like this, so there is an angle which has been formed between the long axis of the forearm and the long axis of the humerus. So there is an angle which has been formed at a medial side, which is called as the carrying angle, which is round about 10 to 15 degree. It is about 10 to 15 degree, which is a normal carrying angle. So you can see in this diagram also the longitudinal axis of humerus and the longitudinal axis of radius and ulna, they form a medial angle, which is called as the cubitus, or which is called as the carrying angle. Now this carrying angle has got an anatomical significance, which I tried to cover in the last lecture also. I'll try to show you over here. Now we studied this. We studied very nicely. This is the distal end of the. This is the distal end of the humerus, and you can see this is the basically the this part is the basically the trochlea, and this is the capitulum. Now if you see, I am trying to cover the distal part. Okay, my pencil will try to show the trochlea. If you can see for yourself, the trochlea, this trochlea. Fine. This trochlea is more distally oriented as compared to the capitulum. This is more distally oriented as compared to the capitulum. You can see this. It is more distally oriented as compared to the capitulum. This is the reason why this angle is taking place, and you can see this is more prominent. You can see the lateral surface of the trochlea is more prominent as compared to the medial surface. The lateral surface of the trochlea is more prominent as compared to the medial surface. So this is the reason why this carrying angle, anatomical reason why this carrying angle happens. Fine. But what is the significance of this carrying angle? Now, if this carrying angle is there, so it will allow number one is that whenever we are walking or whenever we are using our upper limb, it will not strike with the lower limb and the trunk. So it is giving us space to move. Movement of upper limb is easily done. So it is giving us space for the upper limb to move, and it will not hit with the lower limb or the trunk. Second is, it is allowing the muscles or the hand to be closer to the center of mass of the weight we are lifting. So whenever we lift a weight in upper limb, like in hand, so this carrying angle allows that the center, we move towards the center of mass of the weight, so that it is easy for us to lift a weight. So it has got a importance. This carrying angle has got importance. Fine. So this is important. Why so? I wanted to add one more point. Now this carrying angle only happens when the elbow is or the shoulder is extended, elbow is extended, and the forearm is supinated. Now as soon as you pronate this arm, this carrying angle disappears. This is very important point. So this appears only when the arm is in upper limb is in anatomical position. If it is in pronation position, there is a disappearance of this angle takes place. Fine. And you should always write it in this form only, that it is the arm, upper limb should be in an anatomical position itself. Fine. Now there are two conditions which are of significance over here. That is when this angle, can you see the two angles? When this angle increases. Now one thing to be kept in mind is the gender. Now in males this angle is less as compared to the females, and there is another thing is the dominance of hand. That is, the right side carrying angle will be more as compared to the left side. So there is some kind of anatomical difference. So there is an anatomical point as well as there is a general points to be kept in mind while writing about the carrying angle, that it varies with male to female, the gender, as well as it varies with the dominance of hand. Fine. There are two conditions to be kept in mind about this angle is whether this angle increases or decreases. Now if this angle increases, that is from 15 degree, it increases further. That is, the angle is or the lateral deviation is more. That is called as cubitus valgus. That condition is called as cubitus valgus. Now there is another condition when this medial angle decreases. This condition is called as cubitus varus. This condition is called as cubitus varus. Now the cubitus varus is, if I can say conditions, it is not a ideal condition, but it is a condition which happens on only one limb after a kind of a fracture, which is basically a supracondylar fracture. This cubitus varus condition comes. Now when this cubitus varus condition comes, there is basically some deformity which has happened over here. That is, it is called there is which we say is as triplanar deformity. That is, triplanar deformity is that there is a rotation, hyperextension and varus deformity at elbow which happens, which is also called as gun stock deformity. Fine. And it is most common in supracondylar fracture. So this carrying angle has got a very important point because it helps us to move. Fine. Now let us come to the next part. Let us go through this part also. The range of motion is affected by active and passive, as we have discussed. I'm just going to read through the slides because I've already explained you this topic. The range of motion is affected by the active and passive motion as well as the position of forearm. The active range of motion of elbow is 135 to 145 degree. The passive range is 150 to 160 degree. So the active range is restricted by the bulk of actively contracting flexors on the anterior surface of the humerus. Range of motion of elbow flexion is more in supination as compared to pronation, and two joint muscles also affect the range of motion. We have already discussed the active and the passive tension. You can see the triceps as well as the triceps is getting stretched over here in this motion, as well as there is an antagonist biceps is getting contracted over here. So there is an active and passive tension which is happening, which is also responsible for the checking or the factors which affect the elbow range of motion. Fine. So now the close pack position of elbow. The close pack position of elbow is full extension. When the olecranon process rests into the olecranon fossa, that is, there is a bone-to-bone approximation. End feel is bone-to-bone approximation takes place, and there is no scope of any movement. It is called as a close pack position. Now here what happens is that the bony components are approximated. The medial collateral ligament and the anterior joint capsules are totally taut, and they resist all kind of valgus stresses. Fine. And this bony components, that is the olecranon process over the olecranon fossa, basically resist all the varus forces. So all the valgus forces are being or the lateral forces acting on this elbow joint is controlled by the medial collateral ligament as well as the anterior joint capsule, whereas the bony components control all the varus kind of a forces or stresses which are acting. And also along with this, the bony components, the lateral collateral ligament is also helping in it. It also affects, lateral collateral ligament is also resisting the joint distraction forces in extended position, because whenever we take weight in extended position, then this joint distraction forces are being resisted by the lateral collateral ligament and all the soft tissue structures over there. Fine. So this is a very important part which need to be kept in mind. The next is the elbow flexors. Now this is a very important point, is the motion, because we have got 3 major elbow flexors and 2 extensors. Okay, we have already discussed about the 2 ligaments. Now the elbow flexors as well as extensors. Now what is the significance of elbow flexors is they are brachialis, brachioradialis and biceps brachii. Now these, let us see the flexors. These 3 muscles, they basically act when there is a requirement. They don't act all together whenever we are moving elbow flexion. They are generating force at a particular point depending upon what kind of a movement arm we have. For example, we start with the brachialis muscle. Since it is a one joint muscle and it arises from the interior part of the interior surface of the humerus, and it gets inserted just near to the elbow joint. So you can see it is only a one joint muscle. It is not going, it is not a 2 joint muscles, and it is therefore not been affected by forearm position, shoulder position. It is not affected by it. Now the maximum movement arm, that is movement arm is, if I can revise you, it is a perpendicular distance of the muscle from the elbow joint axis. Fine. So this perpendicular distance is more maximum at 100 degree. At 100 degree, the perpendicular distance of the brachialis muscle from the elbow joint is maximum. So it can generate maximum force at 100 degree of elbow flexion. So brachialis is the only muscle which becomes active whenever we do elbow flexion. That means whenever it is isometric contraction, concentric contraction, eccentric contraction, against resistance contraction, any movement, slow motion, fast motion, brachialis muscle will come into action. Fine. So this is the importance of the brachialis muscle. So the brachialis muscle is a mobility muscle. It is its action force is 100 degree. At 100 degree of elbow flexion, maximum torque can be produced because the movement arm is maximum over there, and it is working at slow motion, high speed, concentric, eccentric and all kind of elbow flexion motion. You can see in this diagram the movement arm. Can you see the perpendicular distance? The perpendicular distance from the elbow joint, and this is the action of the brachialis muscle. Now let's come to the second muscle, which is called biceps. Now the biceps, you understand, is a 2 joint muscle, but understand this, only the long head of the biceps is 2 joint muscle. The short head of biceps is a 1 joint muscle itself. Fine. So what happens over here is that the movement arm of that long head of the biceps is maximum at 80 to 100 degree of elbow flexion. It is minimum when the elbow is extended. It is almost 0 when the elbow is extended, and when the elbow flexion increases to 80 to 100 degree, the perpendicular distance of the biceps to and the elbow joint is maximum. So the maximum torque can be produced at 80 to 100 degree. The second thing to be kept in mind is this position it is affected by the shoulder position as well as the position of forearm. So biceps is a muscle, since it is a mobility muscle, and it is affected by the shoulder position and the forearm position, whereas brachialis was not affected by the shoulder position and forearm position. Fine. The biceps is affected by forearm, shoulder position and the forearm position. Now you see that when the shoulder is in extension, the shoulder goes into extension, the effectiveness of elbow flexion is more, and the forearm is, when it is more in supination, the amount of force which has been produced will be more. So that means it is affected by the position. It will decrease when the forearm is supinated or elbow is flexed, because it's a two joint muscle. Fine. So because biceps also help into supination, so it's also a supinator muscle. So that is why it is important to understand the role of biceps. So it is a mobility muscle which has a maximum torque at around about 80 to 100 degree of elbow flexion, and therefore it is not affected when the elbow is fully extended. So elbow need to be flexed at 90 degree to get its action done. Maximum force can be generated over here. So, and it is only active when the forearm is supinated as well as the elbow is little bit extended. So in this position, or it is producing maximum effort. So the next is the diagram here. When you can see, when in the B diagram, first see the B diagram. In B diagram, the distance is, the elbow is extended, the MA is almost 0. Now what is happening in the A diagram? Now when the angle is increasing, the elbow flexion is starting, the MA has started to develop. It has started to develop. It is now 85 degree at roundabout at 45 to 50 degree of elbow flexion. When it goes to 90 degree, it is elbow flexion. There is you can see the MA is more, it has started to develop more, and if at around about 100 degree of elbow flexion, you can see the maximum perpendicular distance is there. Therefore, we say that from 80 to 100 degree, the force production or the torque production will be maximum. Now the role of brachioradialis. Now brachioradialis is a stability muscle basically, and it provides mobility. And when it provides mobility, when it is really important, that is brachioradialis will only come into action when it is we are going for maximum force production and maximum speed need to be produced, then only brachioradialis will come into picture. Fine. So it works, it is not a two joint muscle, it is a single joint muscle, but you have to keep in mind it is affected by the forearm position. So if the forearm is midway, it is more affected when the arm is in midway, because it is responsible for full forearm pronation as well as a midway action. So the elbow should be 90 degree flexed, and whenever the load is applied in midway, then or in pronation, the forearm come into play. So it only comes into play when you are lifting a heavy load, and where it requires the biceps and the brachialis requires another help, that is high load and high speed. We have this brachioradialis come into action. Otherwise its action is more over stability. Now why I am telling it is a stability muscle is because when you see the insertion, it is getting inserted at the distal end of the radioulnar joint. The insertion is going up to the level of wrist. So the perpendicular distance or the length is very far away. So it is bringing only the rotational component. The length is long. So here in the rotational component is bringing about joint compressional or joint stability forces. Fine. So if you can understand the fact, there is the brachioradialis. It is it's a one joint muscle, but it is inserting very far away from the elbow joint. So herein it is giving only the motion is only active at round about 90 degree of flexion. Fine. And below, above or below, the movement arm is very less. So it is maximum effective is at 90 degrees. So let me read through this. Brachioradialis shows moderate activity if the load is applied and the forearm is either in a midway between supination and pronation or in full pronation. The pronation, this brachioradialis will work. So it is inactive at slow speeds. It will not work at slow speed or isometric contraction or concentric contraction. It will only work in when the more forces need to be produced at high speed, whether it is concentric or eccentric. Elbow is at 90 degree, and while pronating or supinating, brachioradialis will come into play. Fine. Yes, other muscles also come into play, but they are not playing, or their action is not at elbow. They are assisting. You understand, there are prime movers of elbow, and there are synergist movers also. The others are the synergist mover, like flexor, diastrom, superficialis. Their prime movement is at wrist and hand, which I discussed in the last class also. Now let us see what are the elbow extensors. Now elbow extensors are triceps, and the triceps is again a two joint muscle, so it will be affected by the position of shoulder. It is affected by the position of shoulder. So you can see that whenever you want to have a good action of elbow, if the shoulder is flexed, the amount of force production will be more. Fine. So the isometric torque generation of triceps muscle is maximum when the elbow and is at 90-degree flexion position. So this is very much important, because this is the in the plank position or in push-up position, the maximum torque is produced by the triceps group of muscle when it is elbow is 90-degree flex. So yes, it has been affected by the position of the shoulder joint. Fine. So today we have studied the kinematics of elbow joint. Now what I have explained is the carrying angle, what are the factors. First, what are the factors which affect the elbow range of motion, like the position of the shoulder joint, the position of two joint muscle, the position of forearm, and this affects the elbow range of motion. Number two is the factors are different for the elbow flexion as well as for elbow extension. There are some ligamentous factors. They all are for mobility as well as stability. Fine. And then I have tried to explain the role of carrying angle. The carrying angle, what is cubitus valgus, what is cubitus varus, and why varus happens, and how the age and gender, or I can say not age but gender and the dominance of the side of the upper limb affects it, and why, in what condition this happens. Varus condition happens because of the supracondylar gunstock deformity. And then we have studied about the muscles here, the muscles which are the prime movers of elbow flexors as well as extensors, and when do they produce maximum torque, and how these muscles are affected by the shoulder position joint and the forearm position joint, forearm position. Fine. So I have covered the kinematics of elbow joint. The next lecture I will be taking about the role of the superior and the inferior radioulnar joint. Thank you guys.